Good afternoon, everyone. This is Saro, Arcadians, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Make sure to subscribe to the channel to receive daily notifications on medication news, update, and education. Today I want to discuss Cimerli or a ranibizumab injection. Cimerli is a vascular endothelial growth factor or VEGF inhibitor. It's indicated for the treatment of patients with neovascular wet age-related macular degeneration or AMD, macular edema following retinal vein occlusion, diabetic macular edema or DME, diabetic retinopathy, and myopic choroidal neovascularization. Dosing may vary for Cimerli or ranibizumab for different indications. For neovascular age-related macular degeneration, it's 0.5 milligram once a month. For macular edema following retinal vein occlusion, it's 0.5 milligram once a month. Again, that's 0.05 ml of 10 milligram per ml solution. For diabetic macular edema, it's zero point 0.3 milligram once a month injection. And finally, myopic choroidal neovascularization, it's zero point 0.5 milligram once a month. It comes in a 10 milligram per ml solution of similarly 0.5 milligram, as well as a 6 milligram per ml solution, which is similarly 0.3 milligram. Some of the common side effects of Cimerli includes conjunctival hemorrhage, eye pain, vitreous floaters, and increased IOP or eye pressure. So again, this is a summary information about Cimerli, which is basically ranibizumab injection. This medication is a belongs to a category of drugs called vascular endothelial growth factors or VEGF inhibitors, as you see over here. It's indicated for treatment of neovascular age-related macular degeneration, macular edema following the retinal vein occlusion, diabetic macular edema, diabetic retinopathy, and myopic choroidal neovascularization. As I mentioned, there's specific dosages per indication for dosing for these patients. You should pay attention to the package insert based on the indication. It could be similarly 0.5 milligram once a month dosing, or it could be similarly 0.3 milligram once a month dosing, such as for diabetic macular edema. And as I mentioned, it comes in a 10 milligram ml, 10 milligram per ml solution and 6 milligram per ml solution. And lastly, some of the side effects that you may experience or the patients you may that are taking Cimerli for the first time especially may experience include vitreous floaters, increased IOP, and conjunctival hemorrhage. So for more detailed information on how to dose the medication, contraindications, side effects, and clinical data, clinical research data, either you can comment on the video and I'll be more than happy to explain more in details about the Cimerli or ranibizumab, or you can refer back to the package insert, especially for dosing, which will give you more information on the dosing of Cimerli, cautions, precautions, and side effects on this medication. Hope you enjoyed this video. As always, stay safe and take your medications.